to acknowledge that we're hosting this session on the unceded and ancestral territory of the Coast Salish peoples, including the territories of the Musqueam, the Squamish, and Tsleil-Waututh nations, and the Métis Charter Community of the Lower Mainland region. And each of you around the province or elsewhere in Canada have the privilege of being on the land, learning more about it, the land and the peoples that have been here tending it for us and with us. And very appropriately for today's conversation, I think we all are committed to ongoing maintenance and nurturing of the land. Next slide. So Province-Wide Rounds is a collaborative venture between the University of British Columbia and BC Renal. It's funded and supported by our industrial partners and all of you in the different health authorities, which is very important in terms of its breadth and reach. So thank you all for both attending and participating in different ways in the programs of work that you see and hear about at this venue. Next slide. So we're really privileged and fortunate to have Dr. Carolyn Stigant present to us today. Dr. Stigant is a mother, gardener, educator, and climate activist who is truly committed to the development and practice of environmentally sustainable kidney care. She completed her nephrology training at the University of Toronto and got a Master of Health Science degree in epidemiology as part of a Kidney Foundation of Canada biomedical fellowship. She conceives and delivers the undergraduate UBC medicine lecture called The Climate Crisis, Planetary Health and Medical Practice, a Call to Action. She's the co-chair of Climate Change and Planetary Health Steering Committee at Island Health, a co-investigator with the UBC Planetary Healthcare Lab, and is the inaugural medical lead for Planetary Health at BC Renal, as well as being the first inaugural chair of the Sustainable Nephrology Action Planning SNAP Committee of the Canadian Society of Nephrology. She's also representing the Canadian Society of Nephrology at Green K, the Global Environmental Evolution in Nephrology and Kidney Care Initiative through the ISN, and serves as a co-chair to that group, which is really important, including the stream innovation infrastructure and in the work stream. Anyways, so I think it's really important that she presents on this week of Earth Week, given that Earth Day was April 22nd. And I think there's a lot to learn from and a lot to do with Dr. Stigant. So Carolyn, without further ado, over to you, please.
Great, thank you so much. Dramatic in the notes there.
Yeah, that's okay, go ahead.
Okay, yeah, sorry about that. These are some of the places and people and creatures that I'm thankful for, reflecting on Earth Day and Earth Week. And I think it's helpful to have these kinds of inspirations in mind, and to know that we can hopefully begin to bring our values into our workplace. So just getting started here, we're doing some work with our committee and have had the good fortune of now linking with some of the good people doing work at the PHSA. And I found this information on their website in preparation for a recent seminar. So just being careful to attribute this work and creativity to Mr. Point, who is a member of the Musqueam Nation. And this, I think, is really beautiful principles to keep in mind. I wish I'd known these at the outset of all of this work, because I think they would have been really helpful. But number 5 in particular, I think is going to be a good guiding principle going forward about really just making up our minds to be strong in this work and doing what we can. So these are the objectives for today's talk, and we'll be just giving some background information on a lot of the positive framework that really led to us being able to make this provincial structure, our planetary health strategy here in BC, and how we can incorporate this work in our working lives here. So this is a bit of a wordy slide, but I'm going to speak to the highlights in the slide, and I wanted people to have the information for their reference. So likely the Paris Accord is something that we've all heard of. We're aiming to, Canada's a signatory of this, as are almost all nations in the world, to reduce greenhouse gases globally 45% by 2030 to reach net zero by 2050. And there's an aspirational goal, of course, to keep warming below 1.5. And this is probably the most negative slide in the whole talk. And I think we can kind of go forward and build from here. But we've now had the first consecutive 12-month period with global temperatures averaging above 1.5, which I think really, really speaks to the urgency of the requirement that all sectors have to contribute in this regard. And so I don't want this initiative to entirely be about carbon. I think, it's certainly understandable why we're all talking about atmospheric carbon pollution, but we're talking about values and a lot of things greater than this. And so I think it's really important that we not just be exclusively focused on carbon emissions, but recognize that they're one piece of a much greater picture of how we're living our lives these days. And I really take inspiration from the writings of Dr. Nicole Redvers, who's an Indigenous scholar here in Canada, who talks about reciprocity and responsibility to the natural world, and to imagine and live out that biospheric values are as well human values. So moving from there, Canada has a Net Zero Emissions Accountability Act, which calls for credible science-based emissions reductions plans in keeping with the Paris decarbonization goals. And we'll come back to that later when we talk about some of the work that we're doing here in BC. Again, you don't have to read all of this, but I want you to be aware that at the national level, at the healthcare level nationally, an international agreement in healthcare, Canada has signed on and committed to development of low carbon sustainable health systems, as well as climate resilient health systems. And happily, these two go hand in hand. Further, we now have a right to a healthy environment. So that was through the United Nations, not binding, but they did hope for a trickle-down effect. And indeed, that is hopefully happening here in Canada with our CEPA bill, which one of the components of which includes our right to a healthy environment. And lastly, in the sphere of our regulatory and our medical bodies, there are now some significant agreements. So sorry for following up a wordy slide with a wordy slide, but I thought particularly the research audience who's on the talk today would be interested in knowing about this academic health institution's planetary health pledge. So UBC has signed on to this, as have 15 of the 17 faculties of medicine within Canada. And for those of you who are writing and submitting grants, as well as all of us who are doing clinical medicine, we should take note of these 7 points, which I'll just go through quite quickly. So aligning an education framework. They explicitly call for the endorsement of the Fossil Fuel Non-Proliferation Treaty, so that we should not be expanding extraction of new fossil fuels. Climate resilient net zero health system emissions. Importantly, how we practice and how we think, reducing overdiagnosis, reducing unnecessary testing and treatment. So I think a lot of work to define what unnecessary might mean. Research, policy, and advocacy, and funding and formal recognition for these actions. They explicitly call on reduced emissions of travel, and that could be patient care or in our academic duties. Interestingly here, recognizing that food systems are about 30% of global greenhouse gases, figuring out how to bring this into our sphere and our circular economy, and de-siloing work. So I'll present today what I hope is a good example of how we de-silo our work. So the PHSA plan, again, it was with the inspiration of Coast Salish teachings, in line with various agreements on the rights of Indigenous people, globally aiming to reduce greenhouse gas emissions, similar to what we just saw about that Planetary Health Agreement to promote sustainable practice, to mitigate climate change impact, improve resilience, and then look as well at our environmental and Indigenous determinants of health. So we'll move on to how we're adapting all of these learnings into BC Renal. So this information is not surprising to anybody. I'm sure you're all aware of the 4 strategic priorities of BC Renal and the 3 foundational principles, and incredibly happy that planetary health is right up there with Indigenous wellness and equitable people-centered care. So our approach here is to really emphasize the connection between our health and the health of our ecosystem. There's a major and growing presence of planetary health on our website with a good amount of resources which are linked there. So we start with a recognition in this problem that there's a disproportionate impact of climate change on those who are least responsible for harming the ecosystem. We're developing a strategy with a working group and beginning with this environmental scan for background, and much of that is complete. And we have a stretch goal. I really was sort of cautious of should we put this out there, but why not? And we need everybody on the line success to stretch to this goal that we can decarbonize our services in alignment with Paris targets and with our government's targets. So we've got an amazing team that's put together. I want to draw your attention here to additional members whose photos we unfortunately do not have for this slide. We have our inaugural entire committee meeting on June the 4th, and we're really looking forward to that. But I reflect really happily that it has not been difficult to recruit for this committee. Again, reflecting the fact that I think we're very keen to live our values at work. So our current areas of focus is really to pick up on and promote existing policies and resources, to raise awareness for these things, to support teaching and education and bringing this into everyday practice, to integrate planetary health in all of the projects throughout BC Renal, to promote champions in every area and introduce strategies to amplify things that are being done really well. To integrate these strategies in procurement. We'll spend a good chunk of the latter portion of this talk talking about the promise in procurement and the importance of procurement, and then optimizing kidney care strategies for environmental sustainability as a sort of optimal outcome of all of this work. So some of you may have had the pleasure of meeting Saba Salim, who is one of our Sabas involved in the life cycle assessment work. So Saba is a UBC Okanagan engineering PhD candidate who we've had the pleasure to work with in liaison with this committee, but through our affiliation with the Planetary Healthcare Lab at UBC. Saba's work is to evaluate environmental and socioeconomic impacts of kidney replacement therapies, and using this information to help develop a strategic roadmap to integrate this work into our overall clinical practice. So she's had some key findings thus far. She's presented at a few meetings last year, some very high profile meetings. She was the inaugural recipient of the CSN's Green Nephrology Prize in this work last year. And this is the really big, impactful, humble little graph here. So this purple bar represents in-center hemodialysis, the carbon emissions from this. The blue bar represents cycler peritoneal dialysis, and the little mint bar here, kidney transplantation. So this key finding from this comparative assessment was that deceased donor transplantation had 91% lower climate change impact than in-center hemodialysis. And I want to emphasize that that's over the first year only. So that's when the highest emission time of transplant is included, and that is the donor nephrectomy and the recipient implantation surgeries. 66% lower climate change impact for cycler PD than for hemodialysis. So we see an obvious message coming out of this, that things that patients prefer, that are most resilient, that happen at the lowest cost and that are aligned with optimal patient care are also aligned with environmental outcome. Another major finding of Saba's work is that home hemodialysis, as compared to in-center hemodialysis, had approximately 80% lower climate change impact. And that's really, really dramatic finding. And CAPD versus APD, we just presented this in poster format at the World Congress, 45% lower climate change impact. So again, we're not using these data to thwart what's right for the patient, but rather to help us frame our messaging. And in years to come, this data may be more relevant for people as they make lifestyle choices going forward. I'd like to introduce you also to Saba Yousafzai, and Saba is another UBC Okanagan engineering PhD candidate, and she's focusing her work on preventive therapies. So we have some interesting projects in development, but for now we're looking at the conservative kidney management pathway, recognizing that there's a lot of variability in that pathway, and looking at how we could look from a life cycle thinking approach to optimize and define the environmental effects of conservative management as well. So I want to thank our engineering colleagues for their key contributions in this area. So everybody knows Sarah Thomas. Sarah, along with Anita, Claire, and Helen Boyd, who's not a renal nurse. Helen's done nursing in just about every sphere, and she's a real force with the Canadian Association of Nurses for the Environment, so that's CANE. They adapted the Planetary Health clinical care model for nursing role within environmentally sustainable kidney care. And this is a key graphic from their very recent publication in our CJKHD that defines what some of these nursing roles are. So I think for any nurses who are on board, this is a must-read paper. It's written really well, and it's got a lot of clinical pearls and ways that nurses can contribute in a meaningful way in everyday practice to environmentally sustainable care. We've also got links to the resources that we've developed on a national level with Cascades. So hopefully everybody by now has heard of Cascades and may be familiar with the website. If you're not, please make note of cascadescanada.ca. So Cascades has a whole host of environmental sustainability materials, and we've worked with them. So I think last time I presented, we talked about the infographic, but the infographic was so meaty, and it was recognized that we really need to delve more deeply in the sustainable kidney care realm, that we developed a playbook with their tremendous assistance. So it's a interactive, highly hyperlinked document that's in essence a sustainable kidney care curriculum. People can go through this in a self-guided manner. And a plug for our upcoming workshop. We have lots of space left. These sessions here, you register once for both sessions, June 4 and June 11. And it's really great because we go through the material on the first session, and then people will choose a sustainability project. And then we can go through that in a workshop and small group format for how that can be implemented. So hopefully there'll be some of you signing up for that. We get a lot of questions and a lot of attention, understandably, in our units for biomedical waste. So I wanted to highlight for people that there is a separate playbook on biomedical waste, although we do address this within our kidney care as well. And for any of you who are interested in general in sustainable systems, there's a separate playbook here. There's a lot of other resources available, but these are just the ones to profile that are most pertinent for our purposes. So we see this kind of tapestry, that I think is nicely coming together on the interconnectedness here. And, as Adira was reading these various things that I do, I really reflect that it's so helpful to have these different levels of engagement, because each informs the other. What we do on the floor in our unit can highlight problems that exist at an international procurement level. And so one can't really effectively address this issue without being aware how to problem solve at all levels. So here we have all of our different units and sites within BC Renal. We're now talking to PHSA. We've incorporated this Health Quality BC lens with environmental sustainability at the core of what we do, being true to values with our Indigenous neighbors. We liaise with our CSN committee, with our Cascades partners, with our academic partners, and with our international partners as well. So the hope is that someone who has a good idea in BC, we can share this through all networks, and it can be amplified eventually all over the world. And why not have a great idea somewhere else in the world that in turn can be shared and brought right back? So I think it's a really exciting time, and I reflect that the better part of these 3 years have been in the groundwork and the conversations to establish these kind of communications networks. So lastly, we'll show some real life examples and some teaching practice plans for how we can incorporate this in our work. So the graphs look a little bit busy, but I'll walk through the key messaging here of the survey. So maybe 6 or 8 months ago, this survey came out, and I want to thank everybody on the line who answered the survey or participated in the survey, and that we see here that we feel that we're reasonably well informed about climate change, about half are average informed, but that this is, I think, really significant, that moderate or more concern about climate change. And this graph here basically shows that the more concerned we are, the more likely we are to do something about it. So that's perhaps an obvious message, but I think a really key one. So although some of this is difficult to hear, this puts the fire in our belly to do better. So I absolutely love this picture. And this, of course, is Sir Attenborough. But I love this quote that saving the planet is no longer just a scientific challenge, although it has been that, but the solutions are there. So this becomes a communication challenge, and it also becomes a knowledge into action challenge. But I think, again, this encapsulates the kind of wonder and beauty that I think that we can bring these values into mobilizing ourselves into action. So with that said, there's actually evidence for how we can implement this care. The first thing is strong regulations, and that was one of the reasons why I started off with that kind of wordy, apparently dull-looking slide, that I hope you all buy in, that we have a strong mandate for this. We have committed leadership, and so certainly that's playing out with our pillars and our committee within BC Renal. And we have some work to do on the measurement and reporting front, but I think we need to really introduce this element of accountability into this work. And then we need to increase capacity. So the way I see it is that people in our committee level, people who are decision makers, they have the top-down kind of capacity. And their job is to really make sure that everybody who's working in this sphere, everybody who's working within kidney care, has the tools in place to perform environmentally sustainable kidney care. So your passion and your enthusiasm for implementing this is the bottom up, and then the top down is what we provide. And then this, what I call this magic in the middle of this vegetarian sandwich. Thank you for permitting me the corny analogy, but I think it's a powerful visual to give everybody the toolkit to do as they can at work. So this is good patient care. And we talked about earlier in that data slide from Saba S's work about optimal outcome aligning with lowest cost, with lowest environmental impact and the most climate resilience. And this depicts this in a pictorial sense. So this is the graphic that we included in our shared responsibility editorial, which came out from Green K, and it shows clearly that as kidney function worsens, that the adverse environmental effects of kidney therapies really expand. So we want to keep up here at the highest level possible: health promotion, early identification, treat the risk factors, adopt lifestyle therapies, when necessary, adopt appropriate pharmacotherapies. And thankfully, as we've heard in other presentations, we've got a growing amount of these pharmacotherapies that can be used. We've got increasing supports for conservative management. We've got a great transplant program. And then when patients end up on dialysis, we provide those services with sustainably powered and low impact net zero waste kidney replacement therapies. So keeping care upstream as high as possible and ensuring that every job can be a climate job in this grand act of kidney care. So we're often asked for a top 10, and I understand where that request is coming from, because it's tempting to just do the right thing and want to get this done. But I think anybody who's familiar with this area or quality improvement in general understands that these are more thematic actions rather than individual checkbox actions. And hence the importance, I think, of this committee, this working group, and this sustained and well-entrenched effort. So I like how we've organized it through cascades into 4 main kind of categories to build our organizational capacity. And again, that's the groundwork that we've laid and are actively working on here at BC Renal and in partnership with PHSA, to reduce disease, end-stage disease, to prescribe optimally, whether that is medications or kidney replacement therapies, and then to explore climate conscious infrastructure. So in subsequent slides, we'll kind of look at that. So again, just bringing to mind this graphic and very much this nursing adaptation of the planetary health model speaks directly to this as well. So keeping this in mind as we go forward. This is just one, you're not meant to read this, but this is one page of the playbook. And it speaks to large infrastructure technology commitments. So purchasing would have to be involved with this, biomed, management. These are not small endeavors for infrastructure improvements, but these are kinds of benefits that we can get from careful planning of our infrastructure. And again, I know it's visually jarring. It's a lot. You're not meant to look through this, but again, this is one page on the infographic that gives you all of these different links for different areas in the world, solutions that people have come up with. So again, just illustrating how a good idea that happens in one area, we can learn from and we can adapt. And we have put together the information for people to seek that inspiration and get those ideas. So moving closer to home, I want to thank Ada Chu and the team at Fraser Health for providing these slides. There was likely some of you are aware of this. I think it's rolled out throughout Fraser Health and certainly here at the Jubilee, and hopefully will roll out more broadly. But this is an example of a local initiative that we can hopefully adapt. So this team wisely recognized that there's a whole lot of intravenous iron that's being administered. And as you all know, the conventional practice has been to draw up the IV iron into a syringe, inject it into a mini bag, and from there put it through this tubing into the hemodialysis system. And so the question came, well, why couldn't we just directly administer that? And so a nursing protocol was devised, and over 2 to 5 minutes, up to 200 milligrams of IV iron sucrose, I'll specify this is specifically iron sucrose protocol, is administered IV push. And this group measured how much waste had been prevented. And look how this really adds up. I mean, 36 kilograms of medical waste prevented with just 490 doses. So it's a dramatic amount. And this is an example of one small initiative that hopefully our committee can learn about and amplify. There's existing communication pathways through nursing education as well. But I would encourage people as they come up with these ideas, let us know, let our committee know. We'll be happy to profile this work. And I think if you can incorporate measurement into it as well, because we're really serious about decarbonization goals. And if you think about it, this is not only material that's no longer being produced, but it's now material that we don't have to deal with in the waste stream as well. So it's really, really significant, and it really builds up. This is a picture taken from Sarah and colleagues' nursing document, and this is based upon the work that was done at the Duncan Community Dialysis Unit. So they looked at their biohazard bin, and this is a before photo, and you can see that there's a whole bunch of plastic waste that's in here, which is not biohazard. And so what has to happen with the biohazard waste is it goes into this container in a yellow plastic bag. It gets taken off and sent for autoclaving before it's incinerated. So it's hugely expensive waste to deal with. And what they did was they just started sorting their waste so that only true biohazard went into the biohazard bin. And you can see here post-intervention in one small community hemodialysis unit, there's significant cost savings. So we don't have a weight saved. We don't have specific environmental data, but I will say that in general, environmental savings mirror financial savings. And so this makes sense in every regard, right? So as long as we can work this into our work stream. So again, thanks to Fraser Health and Elaine Orr for this slide. And Elaine shared with us that their purchasers, their procurement agents were able to get their hands on this supplied biohazard bin. And so it's a bit of a novel system. You'll note that there's no plastic liner bag in here. And so once this biohazard bin is filled, this lid will come down, they'll take away the full bin. And in essence, these are reusable bins, and they sterilize them by non-chemical means. So it's a very environmentally sensitive process which is used. And then these are reused again. So the company will pick them up and deliver back clean ones. So through that initiative, they've been their first department in Fraser Health in their unit to have zero plastic waste of the biohazard waste packaging. So in other words, it's eliminated that yellow bag, which may not sound like a huge deal, but 450 kilograms of plastic waste was saved from the landfill. So I love this. It's very creative. That's the equivalent of all of these things you see here. And you know, we're not measuring carbon savings or global environmental savings, but that's PVC, potentially plastic, that's kept out of freshwater, groundwater supplies and so forth as well. So another idea from Elaine is a safe decrease in heat disinfection to 3 times per week. And that's being done in some of their community dialysis units, depending upon the system, which translates to an energy saving. So again, these small things will add up. So many thanks to the innovations from our partners at Fraser Health. So in the closing few slides, I just want to share with you some of the procurement thinking and work that's happening through Green K and how this might inform our practice here in BC. So I don't mean to specifically pick on any provider, but these are the equipment that we're using in our program. Hence, I had ready access to taking photos. And I want to underscore that this is not just a dialysis initiative, that we're talking about pharmaceuticals as well. But to consider that we're not yet reporting on environmental key performance indicators or quality metrics, though I think we have to do that. But many programs around the world are. And the things that they report on are water, waste, and energy expenditure. So I reflect that when we procure specific equipment, we can play with the prescription a little bit, but for the most part, they come with a fixed energy, water, and consumables. That's like the plastic bits, you know, the lines and the tubing and the dialyzers. All of those are pretty much fixed for us. And so what ability do we have to modify or to do better once we have those things? And hence we need to look at procurement. So globally within healthcare, over 70% of emissions originate from the supply chain. And procurement, as I've tried to emphasize, is more than dialysis equipment. So we're talking about pharmaceuticals and those plastic tubings and dialyzers, consumables. Our dialysis machines is best exemplified within kidney care here, as well as our services that we provide. But procurement is also more than net zero. So we want to get into circularity and design, and we also want to consider the ethics, resilience, cost, non-carbon metrics of our supply chain. So a lot of other things to consider. So this idea has arisen of pro-innovation procurement, and I'll just take a few minutes to explain the process here. So the idea is that we have this unmet need for procurement, meaning we want different things. We want better equipment. So we've thus far defined what our goals are. And we, being myself and my co-chair on the Procurement, Innovation and Industry work stream of Green K, are in contact with procurement experts on all of those different domains that we talked about, the circularity, the net zero, the cost, living planet, all of those different domains. And we plan to incorporate their feedback and come up with what's called a joint statement of demand document. And basically, that's where a whole group of buyers unite in an intended future purchase of needed products. The idea being that we tell industry, go ahead and innovate because we're going to buy the products when you innovate for that. And so you can see that there's a lot of mutual trust that's needed. We need to trust each other that we'll actually commit to this. Industry needs to trust us to be able to make an investment and to change how things are done and how equipment might look. And we need to be true to our words in going forward. So the idea is that the deliverable will be a procurement scorecard, recognizing that not everybody can and should be a procurement expert, but we have a vetted process where we've got greenhouse gas emissions, you know, these kinds of tools that are available embedded within a procurement document. So this takes inspiration from the UN Development Program, Sustainable Procurement Index for Health, and we've used that as a starting point for our work. So the next step will be engagement, recognizing there can be a global market for these innovative products and services. And in June, we plan to have meetings through Green K where we meet broadly with our affiliate member societies. And later to have a session with industry where they can provide their necessary feedback as well. And then after that time, we can procure together. So as an initial starting point, we plan to start with generic JSD, but to move towards product-specific JSDs. And these are some examples of some product-specific JSDs which may result. So we've come up with a wish list with all of this. So at this stage, I want to emphasize that these are ideas. I want to thank Sarah Thomas for adapting these ideas and putting them within this matrix. And this is just, again, such a huge leap forward with our committee within BC Renal to have talents, different minds, and multiple enthusiasms working on this. But we can knock at the right door. So you know when this is something within BC Renal control, then we know when we need to speak to the renal programs, when we need to speak to PHSA, when we need to speak to the Ministry of Health. So proposed priority by influence then, we can roll out our Sustainable Kidney Care Playbook. So hopefully there could be some support for staff to implement this. We could consider increasing the environmental scoring within our contracts from existing 10, perhaps to 15%. That's in line with the most progressive environmental procurement strategy worldwide, which is done in Sweden throughout the country. BC Transplant Partnership for patient-generated materials. What if we had documents that said that patients might actually want to give, or people might want to donate a kidney for environmental benefit? I think that's a novel way of thinking. It may seem kind of radical. It may make some people feel uncomfortable, but in fact, we have a donor who has done just that and is lending her voice to that statement. Nursing practice, I would love to see a consumable strategy nurse position funded and then trialed, and then hopefully that would be a money-saving venture and would be broadly rolled out. Our water could be a resource. The reject water, which is perfectly good, that comes from RO reject, we could perhaps use it for different purposes. Medical plastics recycling, there needs to be a better infrastructure for that, so help and support in that area. We need to implement metrics, and most people don't know, but there is an in-center hemodialysis carbon calculator that was developed in the UK, and it uses, depending on where you log in, it'll use local environmental data. And the data is kept on your server, so it doesn't go back to the UK. They're not collecting this information. This is exclusively for units use. So this is a brilliant tool, and we should all be reporting on our carbon expenditure currently as a baseline. We can advocate to the Ministry of Health for low emissions transport. We can divest from fossil fuel, that's the financial resources of our programs and healthcare services. Energy should be 100% renewable. Why not use our roofs as a platform for solar generation? And we can innovate by streamlining and having facilitation of environmentally sustainable initiatives through Health Canada. So it's sort of like in COVID, where safety corners weren't cut, but procedural corners were cut or given special priority. So I think that the task at hand is ambitious enough that we need to prioritize these areas. So this is a picture that I printed out. This came from the Sustainable Healthcare Coalition in the UK. And it's just kind of a fun way to say that this is all change associated. And it does feel different and it can feel strange, but I want to reflect that the success of this initiative is the success of that vegetarian sandwich in the middle, which is like everybody's action. Like more people can do everything, and we're really working to facilitate those changes on the ground at work. So please recognize that some things may be done differently, and that's okay, and that we'll make sure that it's safe, but that these things make good sense. So if you have a project that you'd like to profile, Health Quality BC has put out an Achievement in Healthcare Awards in Sustainable Healthcare. Our committee is not yet ready to apply for this because we don't have data yet. But thinking about Fraser, where you do have some, this might be a nice idea. Or if there's anybody else out there who's motivated to make a submission, just be aware that these things are coming up quite frequently now. And I think the hard work deserves some profile. So our Planetary Health Working Group will meet on June the 4th. I hope I've shown you that we can have a platform to share successes and operationalize this work. We've got key collaborations and ties with the academic community. We've got key performance indicators, which are being defined by CSN Quist Committee. That's the Quality Improvement Committee. We're waiting very, very eagerly for their publication. However, in the meantime, we can calculate with this in-center hemodialysis, at least our hemodialysis carbon footprint. And we can get a rough idea based upon the work that we're doing with our LCAs as well, all towards science-based decarbonization. So thanks everybody for their attention. I'm grateful for our fledgling committee, all of the enthusiasm, and for all of the collaboration and goodwill in this area. So happy to have some discussion and take any questions, and hopefully hear some more good ideas.
Great, maybe you can stop. Thank you for that, Carolyn. It was really terrific and inspiring, and the comments and questions in the Q&A reflect that. So a couple of questions for you. What's the partnership between, first of all, it starts with great work by BC as a province, but also what's the partnership between BC and other provinces when it comes to achieving the national objectives? And where do you find, are there any provinces as advanced as BC, or are we the leads?
Yeah, I would say Ontario has some really good resources as well through what's called Peach Health Ontario. That's sort of the equivalent of BC Green Care. As far as kidney care goes, I would say that there's pockets. There's some good work happening in Halifax, some good work happening in some of the units in Ontario, but we're far and away the leaders here. And having done this work for 3 years and now having the project management and the committee and the provincial resources backed behind this, it feels like we're working, like we just hit a conveyor belt. It's like everything can advance so much more quickly when everybody is on board. And so I'm actually presenting next week to the Canadian Association of Nephrology Administrators, and a major recommendation that I'm going to have is that they emulate this BC renal model, that you need a committee working on this because it is complex enough. So there is not a pan-Canadian network as yet. I would say it's in its infancy through SNAP. We do have geographic representation broadly through SNAP, but there's varying levels of expertise, commitment, and capacity, I would say, at this point. So that also speaks to the importance of the data collection. And I think that's also next week at the CSN meeting, a bunch of us on SNAP are going to meet and figure out how we can gain better traction. And I think implementing that in-center hemodialysis, just starting somewhere, right? Just get the carbon calculation going, and we can get some national reporting going. So work in progress on the strengths of the national initiative, although we certainly have, I would say, an effective national communication strategy at this time.
Yeah, no, I think, as I think about the stuff that's going on in some of the health authorities, we can even, I'm just thinking about the carbon calculator, like what if every day at the end of the dialysis shift there was a carbon calculator, just a little reminder for everybody, or every morning report, like I'm just thinking of ways to normalize this reporting out that actually increases people's awareness. I just want to read another comment out from Elaine, again, thank you for an inspiring presentation and all the resources that you've helped to create, but also crediting the Fraser Health work to the appropriate people and the team working on the project in Surrey created and shared the slide. So, I think it's really remarkable to think about the small things that people can do that really change things. Oops, there's somebody else talking in the background. Anyway, I think being able to share across and maybe having challenges across the different hemodialysis units by health authority might be another way to help with this.
Yeah, the UK has done something like that too. They call it a green ward challenge. So it's not specifically within kidney care, but I love that idea.
Yeah. Sean has his hand up. We'll unmute you, Sean. There you go.
Thank you, Carolyn. That was a great talk. My question is do we know the carbon output related to pharmacotherapies to prevent kidney disease progression? And the reason I asked the question is that in the GN committee, we recently had to advocate for funding for a new drug. And despite our best interests, perhaps, the argument always comes down to dollars and cents. It doesn't really ever include patient quality of life, and it certainly does not include the carbon impact of allowing patients to progress to dialysis. And if BC Renal is not paying for the carbon impact of dialysis progression, if that is substantially higher in cost than the carbon impact of potentially expensive pharmacotherapies, should we be trying to include those calculations in our business impact analyses, and should BC Renal be paying for the carbon implications of their decisions, which would then make potentially expensive but preventative medications seem on a cost basis more protective, not dissimilar to what the Liberals are pushing down our throats for carbon costs for other decisions we make in life. However, obviously there's going to be costs related to the carbon expenditure related to developing and then using drugs in a large number of people to prevent one patient, for example, from progressing.
Yeah, Sean, I love your question. I thank you so much for your question, because it encapsulates again that this is not just about dialysis, and pharmaceuticals, I think, have the potential to overshadow the environmental effects of dialysis, depending upon uptake of preventive therapies. So that applies to CKD prevention progression as well. And so the first statement I want to make is that, not specifically in GN, but kidney disease in general, the whole healthy lifestyle, health promotion, risk factor identification is at the top of our hierarchy in our triangle. And it's difficult as practitioners who meet people further down in disease stages to do that. But I think as nephrologists, we need to understand that there's environmental factors that affect kidney health. And so it is within our realm of advocacy, information, and expertise that the medical community at large understands environmental impacts on health. To address your question specifically about medications, this year there promises to be a database of pharmaceuticals and their emissions. This has been very difficult information for us to get our hands on. It's something which companies have not had to report on before. And I think now many companies are extremely progressive in this area. And I think I don't normally mention companies, but I will specifically mention AstraZeneca as leading in this area. They're decarbonizing their pharmaceutical manufacturing plants, and they're looking in a very detailed way at their supply chain. One of their talks I went to yesterday, and they mentioned that they have 1,400 supply chain providers. And so it's a massive undertaking for a large pharmaceutical manufacturer to ensure that their supply chain is compliant. But nevertheless, there are international organizations that work with large companies and even medium-sized companies to ensure that they're decarbonizing in alignment with Paris goals. And there's also reporting networks internationally. So medical device manufacturers, pharmaceutical manufacturers are increasingly going to be held to the standard of decarbonizing and reporting on their decarbonization plans and progress. So I would say stay tuned. The UK procurement has stated that by, I believe it's 2028, they need to have carbon footprint data on everything that they purchase for their medical system. So they're moving the entire world forward, because companies are now in the stage where they're starting to measure this and they're starting to have this data. So I think the database will have some legacy information. It won't have like life cycle assessment data, because a really important fact about GN medications is not only the carbon equation, but it would be the toxicity part of it as well, right? Like you deal often with cytotoxic drugs. And so there will be environmental trade-offs in this work. And I think that's a very rich part of our life cycle assessment work, is that we can determine not only what is the carbon metric, but what's the effect on freshwater systems, what's the effect on toxicity, cancer potential, etc. So there's a whole bunch of data to come out in addition to carbon. So I've been long-winded in that, but emphatically agree that we need to report on that data. And I would say, I think that that will become the standard in years to come. It's just that we are not quite there yet.
Yeah, and I think just to add to that, I think you mentioned it, but just to highlight, like the Ministry of Health actually has this innovation and climate change group that Carolyn and I had the privilege of meeting with, that are actually interested in supporting or fostering the increased knowledge about the interaction between climate change and health and climate change, and that bidirectionality. And so I think that's another opportunity for BC Renal to showcase some of the forward thinking led by you. There is another question, which I think, is there a group in BC working on reducing the progression or putting into remission diabetes? I think, diabetes per se is a harder thing, but I think that with respect to diabetes and kidney disease, I would say that is what we all do. But I don't know specifically diabetes. And I imagine that's also to do with the impact long-term in terms of health, but. Any other questions or comments? Carol, I guess, really can't thank you and your team, because I know it's a team effort, enough for not just doing the work, but bringing it to our attention and showcasing it, and for all your leadership, but also I think for galvanizing the province in the kidney space to do all the great things that they're working on. So thank you so much for presenting this, and we look forward to ongoing updates in terms of ways that everyone's making a difference. So thanks again, and thanks everyone for joining.
Thank you. It's a real pleasure and honor to do the work. Thanks for the enthusiasm.
Great. Thanks, everybody.
Bye.